These Spanish travellers at Madrid airport are some of the last Europeans to be allowed into the US.
If the US have to take those measures, let them take them. We need to be prudent and careful, but there's no need to get desperate.
It affects me because I work in the US. I had to change my ticket and bring the trip forward, because if not, I would have found the border closed.
The new US rules mark a sudden escalation in Trump's response to the virus, and they seem to catch US allies and the markets off guard. As well as making political waves, they will be a huge blow to travellers and to airlines operating routes across the Atlantic. The tourism industry has already been hit hard by the virus, as governments tighten restrictions and travellers think twice about whether to go on vacation in these uncertain times.
Well, Trump's travel ban caught a lot of people by surprise here in Europe. Let's go over to correspondent Bernd Riegert, who's standing by for us in Brussels. Hi, Bernd. EU leaders have been holding an emergency meeting to discuss this decision from the White House. What's emerged from that meeting?
The EU Commission and also the 27 member states issued a statement saying that they disapprove of this travel ban, especially because there was no consultation, no warning that this would come. And the EU says that doesn't make sense because this is a global virus and you cannot contain it by just forbid people to travel. And asked to comment on the allegations the President Trump made in his speech. The spokesperson of the Commission only said, we have more serious things to do than to deal with that.
Bernd, what does this U.S. travel ban mean for Europeans?
Well, it means that travelers from 26 so-called Shengen countries cannot travel to the US. These are not all EU member states. For example, Romania, Bulgaria, Ireland are not part of the Schengen zone. So these citizens can travel, but also Switzerland and Norway are included in this ban, and Great Britain is also not included. But the Commission says it's not quite clear how this will work in practice because they have no information how this travel ban will be implemented. Does it concern only European carriers or does it concern American carriers also? And you know there are many mixed carriers like United and Lufthansa or KLM and Air France, and the Commission does not know how this will actually work starting on Saturday morning.
Regardless, it could be very difficult for the European economy, Bernd. So what is the EU doing to address that?
Yeah, there will certainly be an impact on the economy. You can already see that this morning. All the stock exchanges in Europe are down. The shareholders expect things to get worse, obviously. And the European Central Bank is meeting today to come up with some countermeasures, but there are limitations because the interest rates in Europe are already at 0.0, so the ECB might decide to buy more government bonds or more company bonds, but this is all very limited, and the Commission also established a fund to ease the impact of coronavirus worth 25 billion euros yesterday.
Bernd, you know, there is frustration, even anger over this travel ban, but the WHO is calling for drastic measures. So is it time for the European Union to consider similar travel restrictions?
Well, the European Union as a whole is not convinced that travel bans are the right thing to do right now because the virus is already everywhere. So what sense does a travel ban make right now? But on the other hand, you have to say that the US is not the only continent doing that. Also Israel, India, and just recently Guatemala are banning people from Europe to travel to their territory. And also within Europe, there are travel bans in place. For example, Austria and Hungary stopped all travel from Italy to their countries, though this is a very mixed picture here.
All right, DW's Bernd Riegert reporting there from Brussels. Thank you. DW's Nina Haza is following the latest developments on this story for us. Hi, Nina. Hi. This is a pretty big step from the White House. How is Europe reacting?
Oh, it is a huge step. And the EU's top officials have already slammed this decision, and they've said essentially that the coronavirus is a global crisis. It's not limited to any continent. It requires cooperation rather than unilateral action. This is what the EU Commission President Ursula von der Leyen and the EU Council President Charles Michel said in a joint statement as a reaction to that decision. And they were extremely unhappy about the fact that they were not consulted, or they were not even informed about this decision taken by the US president. And then Radek Sikorski, who's a member of the European Parliament and former Polish foreign minister, said on Twitter that I'm surprised that a possible British coronavirus is deemed preferable to an EU one. Playing politics, he said, with health is a bad idea. And that, of course, refers to that exemption for Britain by Donald Trump.
Okay, so we see that this is not really going down that well here in Europe. At least they felt they should have been consulted. At the same time, the WHO is recommending drastic measures. I mean, is it time then that Europe follow the US and also issue similar travel restrictions, a travel ban?
Well, you always have to look at the political systems in the countries. Both the European Union and Germany, for example, if you want to talk about the reaction of one of the member states of the European Union, they are federal systems. So decisions when it comes to health policy, when it comes to education policy, etc., they're always taken at national level, on the EU level, and at regional level here in Germany. And so it's up to local authorities, regional authorities here in Germany, for example, to implement bans on mass gatherings of more than 1,000 people. And also the EU, they have to coordinate their efforts by the various member states. They're all speaking with different voices, and it just takes a lot of time to bring all these different actors together and decide on a more coordinated strategy when it comes to combating the virus.
Well, here in Germany, yesterday we heard the Chancellor, Angela Merkel, say that according to health officials she's spoken to, 60 to 70% of the German population will be infected with this virus. How are people reacting to that?
Well, that's not a number that she makes up. I mean, Angela Merkel clearly is somebody who listens to experts. This is a number that's been passed on by leading virologists in this country who give daily updates on statistics, and they look at how the virus is probably going to develop in the course of the next few weeks and months. And what is clear is that the virus is here to stay. It has reached Germany, and all we have to do is make sure that we gain enough time, that not everybody gets sick at the same time, to not strain our healthcare system too much. And this is something that Angela Merkel has understood. And so she wants the public to understand that everybody can do their share to help slow down that infection rate.
At the same time, we saw the Czech Prime Minister, and we should say the Czech Republic shares a border with Germany, accusing the German Chancellor of spreading panic with those numbers. What did you make of that?
Well, again, this is something where we clearly see that Europe is not talking with one voice, that not every country in the European Union is as affected as, for example, Italy. The numbers are different, approaches are different, the healthcare systems are different. But what the EU leaders decided earlier this week was that health ministers were going to talk to each other on a daily basis to tackle the coronavirus together. And this is something, at least, that's putting the EU on a good path.
DW's Nina Haza with us here in studio. Thank you very much. And we can speak now to Dr. Giacomo Grasselli. He's an anesthesiologist from the University of Milan. He's coordinating the network of intensive care units in Lombardy. Dr. Grasselli, we know you're very busy at the moment. Thank you for joining us here on DW. Can you give us an idea of what the situation is in hospitals right now in Lombardy?
Yes, to give you an idea, I can give you just some very simple numbers. Like before this crisis, we had in Lombardy around maximum 800 ICU beds available for people. And since the start of the epidemics, so in the last 20 days, we have admitted to our ICU a total of more than 900 people. Of these, let's say 120 have been discharged, about 90 have died, and the remaining, around 700, are still there. So from these numbers, you can understand how big is the stress on the system. So we've been able to increase our ICU beds capacity by about 50%, something like that, with a huge effort of everyone. We have reorganized our hospital network in order to centralize the time-dependent diseases like, for example, trauma, stroke, in only in few hubs, and to free space to have new units dedicated. We have created a network of specialized COVID-19 units in several hospitals. And so until now, we've been able to cope with this incredible amount of patients in a very short, limited period of time. But, Lombardy is a very rich and modern region. It's already one of the richest region in Europe. And still, we're really struggling to deal with this incredible, as I say, tsunami of patients who is investing us.
Yeah, we've heard reports of nurses, of doctors working around the clock, working past capacity to be able to treat enough people. We've also heard reports of nurses, healthcare officials having to reach almost impossible decisions of deciding, because there are so many sick people at the moment to treat, who to treat and who they cannot. Is that true? And who is reaching that choice?
Well, that's a very important point, and there are a lot of polemics now in Italy. But I want to make this very clear. Well, in everyday's life, an anesthesiologist, when he's called to see a critical patient, has to take a decision whether ICU admission is proportionate for that patient condition. I mean that we admit to the ICU only patients who can benefit from ICU admission and intensive treatments. And if a patient cannot benefit because of a number of factors, which is not only age, of course, but it's age, past illnesses, morbid chronic conditions, and quality of life, and so on. If a patient does not benefit from ICU admission, he will not be admitted to the ICU, no matter how many free beds you have.
Yeah, we understand it's a really difficult situation that you're facing right now. A lot of people are looking to Italy and saying, with more than 10,000 cases, what has happened there? I mean, why has the virus spread so quickly there?
It's very difficult to say. Apparently here in Lombardy, it happened something similar to what happened in Wuhan. Probably the virus was around for has been around for at least 1 month. Unrecognized, and then something happened, like a super spread event that started this fire, which is very difficult to turn off. And clearly we're having a huge number of patients, an increasing number of patients. And what's different from at least what was reported from China is that the number of patients in the ICU, because in our case series, at least 10 to 12% of the patient, of the positive patient, need ICU admission, compared to, let's say, less than 5% in the Chinese population. So, what I want to make very clear, and what I want to say to tell everyone in the world, is that the solution for this is not opening new beds, new ICU beds, or keep buying ventilators. This is a solution for people who are already sick. So the only way to avoid that this becomes a disaster, and when I say disaster, I mean hundreds of thousands of deaths. The only way to avoid this is to avoid the spread of this disease. And this can be done with simple behavioral measures.
Yeah. Okay.
So you can increase your ICU bed as much as you can. But again, if you are invested by this tsunami, your ICU beds at a certain point will never be enough, no matter how efficient, modern, and powerful.
So, Dr. Grasselli, just to cut in quickly there, what you're saying there is your message to other countries that are facing what your region is facing right now is, please slow the spread.
First, get ready. So prepare your healthcare workers to the proper use of personal protective equipment, for example. Reorganize or try to think how to organize your ICU network, but most importantly, prepare the population. Tell them that once you have the initial spread, they need to change their behavior. They need to reduce their social life. I mean, in theory, if everyone stays at home for 3 weeks, this is going to end, because no new patient should be infected, okay? So I understand it's a big limitation on personal freedom, but the otherwise, this is going to be a disaster.
All right, we'll have to leave it there. Dr. Giacomo Grasselli, an anesthesiologist joining us from the University of Milan in Lombardy. Thank you very much. All right, let's take a look at more of the latest coronavirus developments now. Spain is considering a lockdown of its capital, Madrid. Saudi Arabia has suspended travel by its citizens and residents and halted flights to and from several states. Chancellor Angela Merkel's CDU party has postponed the special conference it was planning to elect a new leader. Many schools across Europe have been closed.